Good day, and welcome to the National Bone Marrow Transplant LINK Mindfulness Matters conference call. Today's conference is being recorded. At this time, I would like to turn the conference over to Ms. Jennifer Gillette. Please go ahead, ma'am.
Thank you. I'd like to welcome everyone joining us today. My name is Jennifer Gillette, and I am the staff social worker at the National Bone Marrow Transplant LINK. I'd like to welcome you to our Lunch and Learn with the LINK. This month's program will focus on the benefits of mindfulness and meditation for cancer patients. It's our goal that today's program will inspire you and equip you with a new skill or idea as you learn how to go through this journey. A special thank you to the Leukemia and Lymphoma Society and our LINK partners for making this program possible today. So just a basic outline so everyone knows how the hour is going to go. I'm going to spend a couple moments talking about the LINK and just some general housekeeping items. And then we are joined by our wonderful speaker, Genne today. He's going to speak for 25 minutes. And then we have a wonderful survivor joining us, Peter Thomason, who will also speak for about 10 to 15 minutes. And then we're going to open the floor for questions or comments. And then at the end of the call, we'll give you some resources as well. So for those of you who may not be familiar with the LINK, our mission is dedicated to helping individuals and their families from diagnosis through survivorship. We provide resources, support, and education. Some of the resources we provide to help families navigate their transplant journey are information on caregiving, coping, treatment options, and survivorship after a transplant. We have our peer support mentor program for patients, caregivers, and donors, our second birthdays recognition program, our books, referrals, and emotional support from a licensed social worker. We provide a variety of other educational and support opportunities, such as the call you are on today. So please feel free to reach out to us if you're interested in any of these services. Before we begin today's program, I would like to review a few housekeeping items to maximize the experience of all on the call today. Due to a limited amount of time, I might need to make some questions a little shorter if they go on when we get to the question portion, just so that we can try to get as many questions answered as possible. If you have more than one question, we also ask that you step back in line rather than asking multiple questions at once. Please also know that the information provided in this program is meant to stimulate conversation with you and your own healthcare provider and is not meant to replace your individualized medical plan. So now on to the educational part of our program. We are excited and so honored to introduce you to our first speaker, Geraghty, who I go way back with. Genne and I worked at the Providence healthcare system for many, many years together. Genne is a certified physician assistant affiliated with Ascension Health and the University of Michigan. She received her training at the University of Detroit Mercy. She has treated radiation oncology patients with all the latest modern medicine has to offer for 20 years. However, she brings a very holistic approach to her patients. She has been in yoga and meditation herself for 20 years, and she uses that at the cancer center to help the patients that come there to deal with the stresses that they're facing on their journey. She joins us today to share about the benefits of this complementary therapy and to expose you all to a mini practice today. I'd also like to just include that she received a special certification a few years ago for a deeper form of meditation called I-Rest Yoga Nidra. So anyway, without further ado, we are honored to have you with us, Genne.
Thanks, Jennifer. Thanks for the intro, and welcome to everybody. I'm happy that you're able to join us. I got into the practice of yoga and meditation when I discovered how good I felt after taking just a routine class. I found that I had less back pain, I was less stressed, and I have a history of lupus, and I had a lot of flares whenever I was stressed. And I found that by practicing yoga and meditation more frequently, I was having less stress, less flares, and eventually I was able to decrease and get off my prednisone that I've been taking for years and years. And know that yoga is simply a moving meditation, so it's all included in those mindfulness practices. A lot of our disease and illness are influenced by our stress. And research suggests that 90% of all illness and disease is stress-related, and that's according to the CDC. The idea that thoughts and emotions influence our health is really an ancient concept, and it was initially abandoned by Western medicine researchers. They were more interested in science and proof and facts. But as time has gone on, they've realized what a role stress plays in our disease and illness. So now there's renewed interest in the interactions and the role that these interactions play in disease formation and recovery. Meditation itself has been around for over 2,500 years. It's adapted from traditional Eastern systems, and it helps to free your mind, and it focuses you more on the here and now. That's why it's called a mindfulness practice. It helps to quiet the distractions of the mind, all that mental overactivity, and it opens our attention more towards the thoughts, feelings, sensations, and emotions that go through our mind from moment to moment. When you practice mindfulness meditation, you're not thinking or focusing about what's coming in the future, and you're not thinking about what happened in the past, maybe earlier today or yesterday. You actually focus on what's happening in this moment. So where you are, what's happening around you, how your body feels, and how you're reacting to what's going on around you. You get immediate effects when you do these practices. They lower blood pressure, they slow your respiration, they slow the heart rate, and they calm and slow the nervous system overall. It can even improve and alleviate pain. So meditation actually gives us an opportunity to have some control over our emotional responses, allowing us and helping us to alleviate symptoms like depression, anxiety, insomnia. We found that the way individuals experience and cope with stress, depression, and anxiety can actually affect the outcomes of disease, illness, and the treatment. For example, if a person perceives an event as very threatening and uncontrollable, they're likely to use more negative coping mechanisms like avoidance, distraction, denial. If a person has very favorable beliefs about their ability to efficiently and effectively handle situations, circumstances, and they perceive a stressful event more as controllable, they're more likely to use positive coping strategies. So they have hope. They use acceptance. They seek out information that can help them understand what's going on better. They plan more on how to solve problems, and they use more social supports from peers and family. Bone marrow transplant specifically has, as I'm sure you're all aware, associated with significant physical, social, psychological, and emotional stress. And I was able to find a few studies that looked at the use of mindfulness interventions with bone marrow transplants. And a couple of the studies that I was able to find indicated that 42 to 44% of post-transplant patients have mood disorders, distress, depression, anxiety, even PTSD. There's evidence that these factors such as depression and the perceived control affect the actual outcome of bone marrow transplants. So there was a study that was done by some colleagues at Dana-Farber Harvard Cancer Center that explored the use of the mindfulness-based therapeutic interventions in patients who were undergoing inpatient stem cell and bone marrow transplants. The findings demonstrated that those participants showed a trend towards having a more positive effect after the intervention, the mindfulness intervention, even when they were experiencing an increase in symptoms, such as nausea or digestive problems. In addition, even when those patients were confronted with the increased symptoms, patients were able to maintain their concentration after a mindfulness intervention, which is really an awesome thing because If a patient is able to maintain their concentration, that can enhance their ability to maintain control of thoughts and their reactions to feelings. The studies indicated overall that those patients who participated in mindfulness approaches were found to have improved quality of life and reduced stress. So in my practice here at the clinic, I have taught simple breath meditation to patients who need something really quick, like trying to make it through an MRI or, a quick go-to calming technique. But I started to get into a deeper form of meditation that Jennifer had alluded to in her introduction. There's a deeper form of mindfulness meditation called Yoga Nidra. It's also called Yoga Sleep. And there's different types of Yoga Nidra, just like there's different types of yoga and different types of meditation. The type that I practice and teach is actually called I Rest Yoga Nidra. And the difference between this one and a traditional Yoga Nidra is just that it's taken the basic structure of a Yoga Nidra and it's enhanced it by adding several therapeutic steps that heighten the effectiveness of the practice. It is research-based. There are a lot of studies being done using this type of Yoga Nidra. It's a trauma-sensitive meditation, relaxation, and healing protocol that deeply calms the nervous system. It supports the integration of negative emotions and thoughts, and it helps build resilience with our everyday challenges. The current research that's being done with this I Rest Yoga Nidra suggests that it effectively reduces stress, insomnia, anxiety, depression, chronic pain, chemical dependency, and post-traumatic stress. So it can be very effective and very helpful. And so today I thought that I would take you through actually a very short practice of the I Rest Yoga Nidra, just so you can experience what it's like and how effective it can be. So wherever you are at, whether you're sitting or laying down, try to get as comfortable as possible, maybe adjusting your body just a little bit to be as comfortable as you can. And then let your senses be wide open. Maybe welcoming sounds that are within the room, and maybe even sounds within the body, noticing what's present. Take a few deep breaths and scan your body, releasing any unnecessary tension in your jaw, ears, eyes, forehead, neck, shoulders, arms, torso, legs, and feet. Sensation of letting go and being at peace. Body and mind beginning to feel deeply at rest and at ease. Everything you experience in this practice, every sensation, emotion, thought, is a messenger. Welcome it with curiosity and openness. Each messenger brings you greater understanding and a feeling of well-being and ease. Affirm to yourself, I am aware, attentive, and at ease. Experience your heart's deepest desire. Something you want more than anything in life. Perhaps something that gives your life purpose and meaning. It may be a desire for peace, maybe a desire for health. Experience your heart's desire as if it's true in this moment. For instance, I am at peace. I am healthy. And take a moment to be with your own heartfelt desire. Bring to mind an intention for this practice. Perhaps it's to remain awake and alert. Maybe it's to inquire into a particular emotion or sensation. Or maybe it's to meet whatever arises in this practice. Whatever your intention, welcome it and affirm it with your entire body and mind. Bring attention to an inner resource. It can be a real or imaginary place where you feel totally grounded, safe, secure, and at ease. Utilize all of your senses to enhance your experience of this inner resource. Noticing sights and sounds, smells and tastes. Maybe there are other people or animals present who love you and support you unconditionally. When you're present in this inner resource, notice a felt sense of well-being in your body, a feeling of being secure, calm, and at ease. And know that you can access this inner resource whenever you feel a need to take time out to rest, restore, and feel totally secure and at ease. Now bring attention to sensations throughout your body. Letting go into sensations in your jaw, mouth, ears, eyes, forehead, sensation in the back of your head, neck, throat, sense shoulders, arms, hands, and fingers. Notice sensations in your torso, inside and outside. Sensation in the pelvis, hips, legs, feet, and toes. Your entire body, inside and outside. Sense the entire body as a field of radiant sensation. Feel yourself as the observer of all the sensations that are present. And affirm to yourself, I am aware, awake, and at ease. Sense your body breathing itself. Smooth inhalation, smooth exhalation. Inhale flowing into exhale. Exhale flowing into inhale. Releasing tension from your entire body with each exhalation. Chest and belly rising with the inhale, letting go with each exhale. Feeling of ease and well-being throughout the body. Experiencing everything coming and going just as it is. You're self-aware and at ease. Yourself is unchanging awareness in which all of these experiences are unfolding. Note and welcome any feelings, emotions, and thoughts that may be coming and going in your body and mind. Welcome your experience just as it is, without judging, without trying to change or fix anything. Sense yourself as spacious openness, letting go even more deeply into the feeling of ease and well-being. Sense joy and well-being emanating from your heart. Perhaps imagining this joy and well-being as a warm, radiant light. The sensation of warmth and radiance spreading throughout your entire body. The sensation of joy and well-being radiating throughout your body and into the space around you. Body and mind at ease, relaxed and at peace. Feel yourself aware and at ease as spacious awareness. Everywhere and nowhere specifically. Everything just as it is. The world unfolding within and around you. Welcoming the truth that in every moment you always know the perfect response to every situation, every challenge, every circumstance of your life. Experience sensations of well-being. Aware, awake, and at ease. When you feel ready, open and close your eyes a few times while welcoming back your inner resource of well-being, that place of safety, security, groundedness. Orient to your surroundings, feeling grounded and connected to yourself and the world around you. As you return back to your wide-awake state of body and mind, allow the feeling of well-being to remain with you as you move back to your daily life. With gratitude for taking the time to experience your health, healing, and wholeness. And a gratitude for taking this time to practice I-Rest. Your practice is now complete.
Thank you, Jan. I loved that. I miss the days of being in your yoga classes. And I hope you all enjoyed that practice as well. As you can see, that was just a taste of how deep you can go with that practice, and it certainly can just bring a higher level of peace. And now we would like to introduce you to our next speaker, Peter Thomason. Peter is a survivor of stage 4 chronic lymphocytic leukemia. He underwent a transplant at the age of 62, and his journey included many trying circumstances that led him to the practice of meditation. He currently has chosen to give back to those going through a similar journey by being a peer mentor for the LINK, a guest blogger, and now a speaker for the cause. Thank you so much for joining us, Peter.
Thank you, Jennifer. Excuse me. I would like to start by saying that I'm probably like many of you, feel still very close to my transplant, but I'm actually on day 1,291 post-transplant. And I like to think that the group that's gathered today here is the M&M Club. It's the Medicate and Meditate Club. Because as much as meditation can be really helpful, most of us know that medication is still a very central part of our lives. I think I still take a handful of things every morning and every evening. I just, even though I'm 3.5 years post-transplant, I had to go back on steroids just a few days ago because of some systemic problems that I'm having, which may or may not be GVHD related. I really appreciate Jan's sharing. My practice is a little bit different from hers. I'm not a Buddhist, but I do practice Zen, which is a kind of meditation which I think I've learned most about from Thich Nhat Hanh, the Vietnamese Buddhist monk. And though I was actually very religious for many years, I don't think of myself as being religious anymore, but I learned this form of meditation actually on a retreat with a Catholic nun about 40 years ago, and it was at a time when centering prayer was getting introduced into some Christian circles, and she was very good at teaching that and helping us learn what some people referred to as continuing to practice the presence of God during your day, or maintaining a centered attitude so that whatever is going on in your day, you're able to deal with it more calmly, more reflectively, and not just reactively, emotionally. You know, some of us, I'd say probably most of us in our position as survivors, I do like to think of myself as more than a survivor in this, but still on the road to new normal. But I think most of us that are in this position realize that there's no parallel, there's no correlation to anything else that we've ever experienced in our life. And I've also discovered that even the most well-intentioned folks, friends, family, professionals, can't really get into our skin in terms of knowing what this experience is like. It's so disorienting. It is sometimes absolutely traumatic. It is being recognized more and more that it's got its own aspects of PTSD. Chemo brain is all too real for those of us who have had chemo and a transplant. But there's also something about a transplant that there's no way of explaining how it really affects you. Sometimes you wake up in the morning and you're afraid that you're going to be feeling sick and you're going to be back in treatment. Sometimes you wake up and you just want to go back to bed, which I do sometimes. I have good days and bad days. But what I've discovered is that through it all, the kind of meditation that I've been practicing now for some time has been most effective for me because unlike probably many of you, during the early days after transplant, I think especially of the first few months, and I had to go on steroids for GVHD almost right away. I was on 80 milligrams a day for months. And the effects of that, we all know, are pretty debilitating. And you feel great in some respects, but you feel crappy in other respects. And I was in hospital for 8 weeks for my transplant, so I lost a lot of muscle mass, I lost a lot of strength. And at the same time, what I experienced was my mind being almost out of control with fear. I was plagued with fear of things happening to my loved ones. I was plagued with fear of not making it because only 1 in 3 of us actually survived the first year. It's the statistics I've been told. So it really pushed me back into wanting to get my own practice of meditation working better. And one of the things that drove me to it was I was experiencing a lot of memory problems from chemo. And so I really wanted to understand more about how my memory worked. And so for me, the way I think about memory is that everything that we have, everything that constitutes who we are as individuals is memory or potential memory, because the present moment moves so fast. It's like thinner than a razor blade cutting through the fabric of space and time. The present moment is an extraordinarily difficult thing to be in because it's constantly moving and we're constantly changing. So my practice of Zen focuses on, I'm a very visual person. I don't really practice yoga consistently. I don't sit in lotus position. I think it's uncomfortable for many people. But my practice focuses just on sitting quietly. For me, it's usually very first thing in the morning after I let the dogs out. And then I go back to my study and I sit. And I could just sit in a chair. And because I'm so visual, one of the things that works really well for me is to just simply imagine a wave rolling onto a seashore and rolling back out again. And then as I begin to relax a little bit, maybe with a cup of coffee, I haven't meditated yet, I'm just trying to meditate. What I will do is just visually see in my mind this wave gently rolling up onto a shore and out again. And then what I do is I just coordinate my breath with the wave rolling in, a breath in, and then the wave rolling out is a breath out. So it's extremely simple, very, very simple. It's not complicated with trying to manage all the thoughts that are coming in or all the other sensations or feelings. I use other time journaling to deal with thoughts and emotions. What I'm really interested in doing is disciplining my mind and my emotions so that I'm not always in this, experiencing this sense of chaos from them, which, as we all know, can be overwhelming. So the way I, in my practice, deal with those thoughts and emotions as they come in, rather than dealing with them right at that time, because I'm trying to discipline my mind, sort of like the way you have to teach a puppy to heel when you're training a dog. You can't just say heel and have them expect to know what you want. You have to show them that healing through certain behavioral modifications. You have to show them what healing means. It means you stay by my side, you walk with a loose leash, you don't go sniff everything that you can smell, but you discipline and train your mind to heal. So for me, what that means is that if something comes into my mind, rather than holding on to it and examining it, I just let it keep going. So visually, what that means for me, it's sort of like a bottle with a message in it coming in with that wave, but instead of letting it land on the seashore and opening it and seeing what's inside, I just let it roll back out again. So it comes in and let it go back out. And I find that to be very effective. It's extremely simple. Maybe it works best for me because I'm a survivor. Maybe it works best because I've struggled with so many emotions and thoughts post-transplant. But that seems to be what works best for me.
Hey, thank you so much, Peter. There's definitely many ways to do this, and I thank you for sharing what has worked for you. So at this time, Nadia, can you please share with the participants how they can ask questions?
Absolutely. If you'd like to ask a question, please signal by pressing *1 on your telephone keypad. If you are using a speakerphone, please make sure your mute function is turned off to allow your signal to reach our equipment. A voice prompt will indicate that your line is open. Please state your name before posing your question. Once again, press *1 to ask a question. We'll pause for just a moment to allow everyone an opportunity to signal for questions.
Okay, and while we're waiting for everyone, feel free to share your first name, but if you don't want your last name on the recording, you do not need to put your last name too, just as a reminder. But and while we're waiting for callers to come in with their questions, Genne, do you have any recommendations if someone wants more information about iRest yoga?
Yes. Actually, there are CDs and downloads that you can get for the practices themselves. iRest has a website. It's irest.us. And you can go on, and they have a couple of CDs there that have multiple practices on them. So you can do very short practice like we did today, or you can do a little bit longer, maybe 20 minutes or 35 to 40 minutes. They are also available on Amazon.com. You can either Google iRest or two of the CDs that are really nice. One is called iRest at Ease, and the other is Resting and Stillness. And they're both by Richard Miller, who is the founder of the iRest program, and he developed the protocol. And it's the letter I, R-E-S-T. So they can be very helpful, and they're really nice CDs to listen to.
Great, thank you. Do we have any questions in the queue?
Yes, we do. We'll take our first question.
Hello.
Hello.
Hi. Yes, did you have a question?
The participant is not speaking, so we'll take our next question.
Okay.
My question was actually answered because I was wondering where I could get information on how to do this practice.
Well, wonderful.
All right. Once again, if you'd like to ask a question, please signal by pressing *1. We'll take our next question.
Hi. Thank you for that meditation. Thank you for the survivorship talk. This is Ellen. I had my transplant almost exactly a year ago in a day for myeloma. I didn't have any meditation practices when I was in transplant, but now I've been doing them quite steadily. I guess my question is, during that iRest exercise, if you have difficulty relaxing, which is probably the whole point of this thing, but if you're really super tense and have difficulty, is it better just to listen to the stuff, or is it better to try and follow the instructions that you were giving? Like, picture this, picture that. Does that make sense?
If you just listen to it, you will absorb the practice. Even if a lot of people, especially in the longer practices, will fall asleep, and that's okay too. You will still absorb it. Even if you have trouble with relaxation, I think the more that you listen to it, the more your body will start to relax and let go. Again, when you do the longer practices, you go into a little bit more detail, so maybe you spend more time on noticing sensations in the body, or you spend a longer time focusing on the breath, which will also help move you towards greater relaxation. So it's perfectly okay to just listen to it, or follow the instructions a little bit more. Obviously, if you follow the instructions a little bit more, it helps you to move your awareness to different places in the body or to the breath. And so that's also going to help you to relax and let go a little bit more. Does that help?
Yeah, that's helpful. I just know how I'm kind of so reactive, even to the little bit. It's so alien to me to lose that tension that sometimes it's not a resistance. It's just like, whoa, I can't handle this because I can't do it, So I guess it's that trying to do a little bit that I can just kind of ease into.
And the biggest thing is not to judge it, just to experience it. So if your experience is one particular way, it's still okay. You know, to just let go of the judgment and to let go of the trying to change or trying to fix anything, that's not the goal. It's just to be with where you are at that moment.
Yeah, I'd have to agree with Genne. That's been most helpful for me, too. I did find, however, that just learning to be aware of your breathing can be an incredibly helpful first step. And as you pay attention to it, I mean, there's really nothing more present than breathing. Your thoughts come and go. You can follow them like shadows. But if you start, if you just practice paying attention to your breath in and your breath out and just listen to it, don't even have to think about it, it's a really great starting place, I think.
And I agree with that. That's typically how I work with my patients, is to teach a real quick go-to, following the breath from beginning to end. Always remember that you always have control of the breath. Can't control anything that's happening or anything around you, but you can always control your breath. And simply by focusing on it, slowing the breath down, breathing in and out, following each inhale and each exhale from beginning to end. Those thoughts come in, it's okay. We're not trying to completely eliminate thoughts. It's just to be more aware of what's present. But come back to the breath each and every time. And the more you practice that, the easier it becomes. And the quicker you start to recognize when you do lose the breath or your focus on the breath, and you'll come back to it each and every time. But it's impossible to be tense or stressed if you stay connected to the breath and follow it from beginning to end. Mind and body automatically begin to calm and relax.
Absolutely. Yeah.
Thank you.
You're welcome.
You're welcome.
Once again, if you'd like to ask a question, please signal by pressing *1.
Is there any other questions?
Yes, there's a question that just queued up. Please go ahead.
It's Ellen again. I guess I'm the only one with questions. So in relation to what you said about, the research and the outcome of certain things when I think what you said, when you're less stressed going into medical interventions. Can you talk more about that? Because I have a ton of medical PTSD that was there before the transplant. And now even just my other appointments, they're just super fraught with that. And I have a therapist. I go and we're working on it. But in terms of the meditation part, do you have any suggestions or information about how to approach just the non-cancer doctor appointments? Because it's kind of transferred over.
I can address that a little bit. Is it Ellen? Ellen?
Yes, Ellen. Yes.
Yeah. Ellen, I can totally relate to it. I just found out I've got 3 aortic aneurysms. I've got several hernias. I've got, you name it, I'm dealing with it. So I think many of us, it sort of amplifies all of these other ailments that we have, whether they're GVHD related or whether they appear to be unrelated, but they still seem to trigger a lot of anxiety. I know they do for me. And especially and some of it's just, I think it's just unavoidable. Certain levels of anxiety are just, they're hardwired into us. But I think the practicing meditation, as Genne said at the beginning of her sharing, was, it kind of gives us a tool to help mitigate some of this. And I would, my suggestion is just, if you've got a doctor's appointment or 2 in one day, sometimes for me it's 4 or 5 a week, is that day, or even as you're
Could Could you speak up a little bit? It's hard to hear you on my phone.
Sure.
Okay. Thanks.
That day that you're getting ready to go into a doctor's appointment, a cardiologist, whatever, is just be particularly mindful that day to do some meditation before you go. I'll even sit in a waiting room and meditate and just listen to my breath, close my eyes. Nobody cares. And just as I'm waiting to go in, or if I'm sitting in the doctor's office waiting for the nurse or the doctor to show up, I'll just meditate some more and try to just use that as a way to calm my emotions and my fears. So it's with you all.
Jennifer, also responding to your question, I like what Peter was saying, that, using the meditation throughout the day, certainly the practice, the more you use it, just like if I do a bunch of crunches, I'm much more likely to get a six-pack. But if I have done it one day, I won't. And so I think the more you use meditation in your life, the more your brain just becomes trained to respond to it. But I know sometimes I recommend, just like Peter was saying, I've shared short little exercises with people. Like if you close your eyes and take in a deep breath and hold it for like 3 seconds and then slowly let it out. Some people call it triangular breathing, where you breathe in for 3 seconds, hold it 3 seconds, and then release for 3, and then try to keep moving up. So maybe you'll get to 6 seconds, where you breathe in for 6 seconds, hold for 6 seconds, and release for 6 seconds. And some people try to get higher if they're able, and maybe do 10 seconds. Because the basic concept is that if you can slow that breath is telling the rest of your body, it's signaling it what to do. And so if your breath is really rapid, it's telling everything else in your body to respond to that there could be a fight or flight situation. So if you keep trying to get that breath under control, keep trying to slow it down, and you practice this on a regular basis, it's going to help make those appointments easier. Now, in the interim, PTSD, we know that is definitely something that a lot of cancer patients deal with, and it can go over into other areas of your life. If you're seeing a counselor, you could even discuss whether there's maybe some short-term medication that could even possibly be added for now, because there's many tools that you can use to try to get anxiety under control. But the meditation is one that the more you practice it, the stronger it's going to be used in your life. I hope that helps.
Absolutely. Yeah, absolutely.
And just to add, just for information, the IREST protocol was actually started, the first study that was done was PTSD for vets returning from the military who couldn't sleep, who couldn't function, couldn't work because they were so anxious and they were always in that fight or flight response. And they found that by doing that practice, and the research, the study is out there. You could probably Google it or get it from that irest.us. But they found that it was actually helping them to calm and be able to function once again in society and sleep. And their reactions were much calmer. They weren't going right to that fight or flight response. It like Jennifer said, it's like your brain is building a new muscle. So the more you use it, the stronger it gets, and the more you can rely on it.
Yeah, I just think it's a lot of that idea that you have these negative thoughts or negative things going on, because obviously going to these appointments are not like fun, right? So they're kind of icky anyways. So it's that kind of like, oh, I don't want to feel icky, but you can't just snap your fingers, and I can't really use a lot of prescription meds because of my sensitivity, which again was difficult with all the chemo I took. But I guess what I'm trying to say is, that phrase of turning something negative into a positive, because if all you have is crappy stuff, you still have to be able to make something positive out of it, with the crappy stuff. Do you know what I'm saying or no? I'm just babbling.
Absolutely. And I think, with your therapist too, like using cognitive behavioral therapy and getting to some of those thoughts too and working through some of those past emotions, that can help you in trying to also take captive those thoughts and turn them around. I don't want to oversimplify it because I know it's a lot easier said than done. It takes a lot of work to work through PTSD, but, continually reminding yourself that, going to the doctor and trying to get answers to deal with what your body is facing it's a tool for you. And so focusing on that there is hope walking into a doctor's office to get a tool to help your body. But, again, I don't want to minimize your experience because I know there's a lot of messages your body is telling you that this is scary to walk into a doctor's office, and for good reason. But those doctor's offices, as challenging as those moments have been, those doctor's offices have helped you overcome and be here to live the life that you have so fought so hard for. But certainly, your therapist can work with you on some more of the cognitive behavioral therapy. There's also DBT, which is a really good therapy for helping people too. And also there's some research with something called EMDR that...
we just talked about that. I did it in the past, but we're going to start it again.
Yeah, it's something, there's definitely some good promise with that approach, and, because the amygdala holds on to those things, just like I learned not to touch a snake that bites, somewhere in my body remembers that and says, okay, don't touch snakes, they bite. And so when you have all those traumatic experiences, your body tries to hold on to that to educate you, but it takes it out of balance to the point where it's telling you that it's scary to go to the place where you could indeed get help. Does that make sense?
Yeah, exactly. Yeah, that's why it's so hard.
It is. It's very hard, but, don't give up. There is a lot of people that find ways to work through that, and I think having a good team around you, being really honest with your doctors, if there's social workers there, there's a whole group of people, and using these holistic things like the meditation, there is a whole toolbox that can be there for you to help you overcome this.
Okay, thank you. There's one more question.
Okay, go for it.
Hi, this is Russ.
Hi, Russ.
Hi,
Russ. Hey.
I learned meditation years and years ago, and it was all about the kinds of things that you had mentioned, Genne, positive thinking and relaxing all parts of the body and all that sort of thing. And then mindfulness came into the picture, and that's been touted a lot in more recent years. And I didn't do much research on it, but what I've heard mostly from people describing mindfulness is to think nothing, which I struggle with, especially since I learned to do the other, to think positive thoughts and affirmations and relaxing all parts of the body. Because if you're thinking absolutely nothing, then even bringing positive thoughts into your mind is the opposite of what I've heard relative to mindfulness. Does that make sense? I'm just trying to figure out, and I think maybe part of the answer is what you guys have been talking about in the last few minutes about just paying attention to your breath.
Right. When you practice the meditations and the mindfulness, it's not necessarily, you don't want to stop yourself from thinking. That can't happen really, because your mind's tendency is to think. It's about being able to slow the thoughts down so they're not erratic and they're not just, causing a lot of distraction. You can notice the thoughts that come up, but then they kind of subside. You can try to set them aside, and like Peter said, he acknowledges the thoughts and then kind of tells himself that he's going to deal with it a little bit later. So it's not going to be something that you dwell on throughout the whole practice. They just kind of come and go, and they're present, but you're not able to stop yourself from thinking. And that's why a lot of people get the idea that they can't do meditation because they can't stop themselves from thinking. That's not exactly the goal. The thoughts will be there. They're just fewer and calmer, and we're just acknowledging that they're there. But they're not our full focus. Does that make sense?
Yeah, thank you.
Yeah, this is Pete. Jan is right, and I wasn't trying to imply that you're disavowing thoughts or that that's not part of who we are, because it definitely is. But for me, it's just, as she said, it's just acknowledging it's there like a message in a bottle, and then letting go of it, back out with the wave, and saying, okay, well, I will deal with that, but later. Right now, I just want to be quiet, and I don't want to have to deal with all those different things that are in my mind about fear of a doctor's appointment or whatever may be coming. So to me, again, that's sort of like this idea of, of training a puppy, because, and interestingly enough, our dog trainer is a breast cancer survivor herself. And she just opened my eyes to this aspect of training and discipline. Like I said, you can't just tell a thought to go away. You can't just tell a puppy to heel and expect that they're going to know what to do. It's a process. It's a process of learning how to deal with them.
That makes sense to me, Peter. Let me take that a step further in terms of, so if I know that I'm going to deal with it later, then when and how do I do that? Do you have any examples?
Well, I'll use a practical example. My wife is a night person. I am absolutely a morning person. So but usually by 7 in the evening, I'm done. We have a small farm, so we're usually working all day long. We're quite busy. There's good days and good weather. But I think of it sort of the way I do it, that she and I have learned how to deal with talking about things or thinking through things. And she'll bring something up after 7, and I'll say, honey, my capacity is gone. And I can't talk about this tonight. And it's not because I don't want to talk with you. It's because I don't have the capacity. I don't have the energy to do it right now. So we agree, well, we'll talk about it in the morning during our coffee time. Well, it's sort of like the same thing that you do with yourself. Just make yourself a note. Okay, think about how I'm going to respond if I get a negative MRI, if a CAT scan comes back bad, if I turn out to have some kind of respiratory problem, GVHD. But it's the same kind of thing. It's disciplining yourself enough to schedule time. I know it sounds a little bit, like very calculated, but in a sense it is, because my life is so different now than it was before. I used to be able to juggle a million things at one time. Now I can't. My capacity is much decreased on so many levels. And it's very decreased in the level of being able to cope with thoughts. So if that helps, that's just a practical suggestion. Just make yourself a mental note or write it down. Think about this later.
And I am so sorry, but I see that we are coming to a close here. We have reached past 1 o'clock. So I want to thank everyone for joining us today, to our speakers. I think we've done a great job introducing this subject to people. And if anyone has any additional questions, just so you know, we are going to be sending a survey out either later today or tomorrow that you can, one, give us feedback about this. You can give us ideas for future educational events. But also, if you have any questions, you're welcome to include them there. And I also want to let you know that we have a webinar coming up on the 29th on survivorship. If you go to our website, if you're interested in that, you can certainly register. And if you'd like any further information, whether it be about survivorship, supports available, feel free to call us at the link at 1-800-LINK-BMT. We also are looking to expand our peer mentors, and so for those that are calling to speak to someone who's been through it, so if anyone's ever interested in that, we'd love to hear from you as well. So thank you again to our speakers, our sponsors, our link partners, and all for joining us today. We hope you have a great day.